But as the number of opioid deaths are going down, the FDA has now approved a new drug that is said to be 10 times more powerful than fentanyl. And that is raising questions about the potential for abuse and overdose. Heather Abraham spoke with a doctor who specializes in pain medicine with Allegheny Health Network.
Dsuvia, a small single-dose pill, was approved on Friday after a 10-3 vote by the Food and Drug Administration, but it's being met with a lot of concern and questions.
It's a very niche medication as it was developed, and the manufacturers actually work with the Department of Defense in some aspects in the development.
Dr. Jack Kabezi is the Division Director for Pain Medicine at Allegheny Health Network and says the medication, which is placed under the tongue and dissolves, would be likely used for a small subset of patients.
They can't take something by mouth for whatever reason. IV access is poor. They can use this medication to give someone pain relief equivalent to 5 milligrams of morphine in 15 minutes.
Which is part of the reason for the Department of Defense's involvement in the development. The headlines for Dsuvia have read 10 times more powerful than fentanyl, which we've seen the lethal consequences of as it made its way to the street, and 1,000 times more powerful than morphine. But Dr. Kabezi says that's misleading.
On a milligram per milligram basis, it's 1,000 times more potent than morphine, but it's dosed in micrograms. So 30 micrograms is equivalent to about 5 milligrams of IV morphine.
And Dr. Kabezi says there are tight restrictions on its use.
Keep in mind, this is not going to be in any retail pharmacies. It's not for at-home use. It will not be dispensed with a prescription. It's not to be used any longer than 72 hours.
Dsuvia is expected to be reviewed by Allegheny Health Network in the coming months. Meanwhile, Dsuvia is expected to be available in the first quarter of 2019. Heather Abraham, KDKA-TV News.